Okay, we are exactly on time, so we are ready to start. Welcome everyone. Good morning, good afternoon, good night, good evening, depending where you are. Thank you very much for joining us for another exciting seminar from ISN.com. So today I'm going to be your moderator, and I don't need any more introduction. You know me. And on behalf of the International Society of Nephrology Renal Pathology Working Group and our leadership, Dr. 𝗟¿c̬ HISHN, our Deputy Chair, Dr. Ahmed Kalebi, and the group of pathologists that are part of the Renal Pathology Working Group and are representing the pathology from all continents, we welcome you today. The floor is yours.
Thank you very much. It's a pleasure to be on this GLOMCON seminar presentation. And many thanks to Prof. Surya, our chair, and Prof. Carmen, our former chair, for the invitation, and particularly for the topic, which is quite interesting. I'll be talking about the insights on histopathology of glomerulopathy associated with parasitic infections. As a disclaimer, although we have a lot of parasites in our region, I actually haven't seen much in terms of confirmed glomerulopathy associated with parasitic infection, and I'll be talking about why this is so. And perhaps this gives us a chance and an opportunity to really look at areas in which we can research more about glomerulopathy, glomerulonephritis associated with parasitic infections, these being infections that commonly occur in tropical countries where most of these diseases are neglected communicable diseases. So my presentation, as an outline, I'll be talking about the overview of parasitic glomerulopathies, particularly in reference to tropical and endemic regions, the general histopathological spectrum that we see and the diagnostic tools that we have, common lesions that are often associated with parasitic glomerulopathies, and I'll also go into a few of the common parasites that have been reported to be associated with parasitic glomerulopathies, including protozoal infections, helmintic infections, others like 𝗙cie_𝗂𝗃𝗃, and I'll finish off with a diagnostic and management overview, as well as research gaps that we can look into. So, as you all know, there is a broad category of parasites that affect humans. These include endoparasites that live within us and ectoparasites that live outside us. Some of them are residents, others are visiting parasites like mosquitoes. And in the context of glomerulopathies, we'll be mainly talking about parasites that live within us, and these include protozoa. You might be surprised that some, like Giardia, are actually associated with glomerulopathies, proven cases, and then mainly helminths, and you'll see why they are such a challenge because of the antigenic complexities. Arthropods are rare, but we do have 𝗙cie_𝗂𝗃𝗃 being reported. So you all know about the different categories of common parasites in humans, from the single-cell organisms that are asexual to helminths that are more complex, which are dioecious, and they have male and female or hermaphrodites, and I'll be mentioning the key ones. Globally, as you can see from this heat map from WHO, I think that was from 2004, there might be an updated one. The burden of parasitic infections mainly is around the tropics and, unfortunately, in the poorer countries. So Africa lights very red. The deeper the color, the more intense the burden of parasitic infections. Mosquito is rather Plasmodium malaria tends to be one of the most prevalent, as well as foodborne or soil-borne helminths, and these are the areas that are most affected. Obviously, if you go to some certain organisms, they might vary with areas. So South America has a high burden of certain parasites compared to other parts of the world, but overall from this map, Africa and most of the tropical countries around the equator are the ones that are the most leading. And these are usually areas with high temperature. And as I say, they are mainly in the low and middle income countries. So it is said that over 1 billion people are affected by neglected tropical diseases, mainly parasites, which cause up to 120 deaths. And malaria is the most common and is the most lethal. Up to 94% of sub-Saharan Africa actually has malaria, and I'll be talking about it. Other common parasites include Leishmania, Chagas disease, 𝗙𝗪𝗲𝗄𝗃𝗄𝗃, as well as scabies and fleas. So as an introduction to our topic today of parasitic glomerulopathy, is that, as we all know, glomerulopathies, particularly glomerulonephritis, will impair kidney filtration and often are immune-mediated. So the fact that parasitic infections are so prevalent globally means that it goes without saying that if they are actually associated with glomerular disease, then probably a big number of cases of immune complex mediated disease that are said to be idiopathic might actually be related. The parasites that we have known to be reported in the literature includes Plasmodium, Leishmania, Toxoplasma, Trypanosoma, as well as Schistosoma, Escherichia, Echinococcus, Toxocara, Ascariasis, and Sarcoptes. And the main mechanism for glomerulopathy for most of these cases is immune complex deposition due to chronic antigenemia, antibody immune complex deposition, and cytokine injury. I'll study the references as I go along, but basically the pathophysiology is thought to be predominantly related to the host parasite immune reaction. And because these parasites are complex and they live within us, the chronic antigenic stimulation and antibody production with Th2 mediated response leads to B cell activation, a lot of immune complexes very similar to systemic autoimmunity that has been proven in some experimental rat models. And ultimately, this leads to the glomerulonephritis. Unfortunately, the exact mechanism remains poorly understood, and we know more about things like membranous nephropathy and others because of wonderful studies that have been done. But as you can imagine, glomerulonephritis associated with parasitic infection remains poorly studied and poorly understood. This is basically a diagrammatic presentation from one of the papers, which is a review paper, and you can relate to most of what is being depicted here in terms of both innate immunity, cellular immunity, humoral immunity, and a complex interplay between the two that ultimately leads to the common injuries that are associated with the endothelium in membranoproliferative glomerulonephritis, as well as mesangial deposition in mesangial proliferative glomerulonephritis and membranous nephropathy. From a histological perspective, the commonest lesions associated with parasitic infection in parasitic glomerulopathy is actually mesangial proliferative glomerulonephritis, as seen in Leishmania, Schistosoma, but virtually can be described in most of the others. Then MPGN, FSGS, and membranous nephropathy. I'll talk about a quick glossary of terms just to keep us all in the same loop. When you talk about membranoproliferative glomerulonephritis, here we talk about mesangial and endothelial proliferation due to various injuries, and these are stimulated mainly by extensive antigen, antibody, and immune complex deposition in both the mesangial and some endothelium associated with endothelial damage, which manifests as membranoproliferative glomerulonephritis, basically an inflammation of the capillary wall and the mesangium. And most of the time, they'll present as isolated proteinuria or